Welcome to our mnemonic video on Ileus. Let's begin. This scene will take place at a fascinating local park. In the foreground, we see a large segmented worm as well as a couple of smaller worms. The large segmented worm is here to remind you of the large bowel, while the smaller worm is here to remind you of the small bowel. The worms are static and not moving to remind you of the state where the bowels are static or not moving, which is known as ileus, the focus of our video. First, let's start by discussing the diagnosis of the condition. One of the park visitors couldn't tolerate the sight of these worms. Instantly, he became nauseous with belly pain, which is why he's holding his whole abdomen. He couldn't help it, so ultimately he puked. This idea is here to remind you that an ileus patient will have a history of diffuse abdominal pain, nausea, and vomiting. Before he vomits, he was blowing up that large segmented balloon and about to tie up the balloon's neck to keep it in shape. However, on his sight of the big worms, he dropped the balloon untied, yet we see the balloon not leaking air. The balloon is shaped like a colon filled with air, and the fact that there is no air leaking out should remind you of an absent flatus associated with ileus. Another visitor seems to be traumatized by the big worms, which made him lie down. Luckily, a med student was passing by when he saw this big guy. Using his stethoscope, the med student was trying to check out this guy's large abdomen. However, it seems like it caused him pain, as we can tell by his agonizing facial features. This idea should remind you that the physical exam of the ileus will reveal a diffuse abdominal distension and tenderness. Looking at the med student, we can tell he is uncertain about what is wrong with this guy since he could not hear any bowel movements. This will remind you that auscultation of an ileus patient's bowel will reveal a decreased or absent bowel sound. Not everyone in this park is traumatized, however. To the left side, we see a teenage explorer who's obsessed with worms. It seems like he couldn't find the worms that everybody is talking about since he's looking for these gigantic worms in this old man's statue. Instead of exploring through the mouth, he decided to start where everything ends in a way that reminds us of a rectal exam. As he explores the rectum of the statue, the first thing he encounters is a hard poop toy. Putting together the age of the statue along with the rectal exam and the hard poop toy should remind you that a rectal exam is required to rule out fecal impaction in elderly patients. Clueless about what to do next, the med student decided to call a friend doctor to help him in this chaos. The doctor showed up in a lab coat ready with his chart. Instantly, the doctor started to investigate and ask people around about anything that can help in concluding the cause of this drama. The doctor questioning this woman here should remind you that clinical history is an important clue and must be considered in diagnosis of ileus. The doctor's chart wasn't the only thing he brought, though. He also brought a portable x-ray device to help investigate and see what's happening inside these traumatized people. If we look closely at this x-ray, we can see the small and large bowels are enlarged and filled with gas, sparing no area of the film. This idea should remind you that an abdominal x-ray is the best initial test for evaluating the ileus and will show distended loops of the small and large intestine with air seen throughout the colon and the rectum as well. This is an important diagnostic feature when compared to small bowel obstruction, which will reveal an absence of air distal to the obstruction. Before this woman gets caught in the x-ray device, she was about to buy some cotton candy from this oddly long cotton candy machine. If we look closely, the machine looks like a CT machine to remind you that the most accurate test is a CT scan of the abdomen. Now that we've discussed the diagnosis of ileus, let's move on to discuss the treatment, which is conservative management mainly. The woman was going to buy some cotton candy, but where is the seller? Here we see the seller in a gray shirt. The guy in the black shirt was trying to ease his friend's pain, so he thought of giving him some opium narcotics. Thankfully, the cotton candy seller rushed and interfered rapidly by taking away the poppy plants, our symbol for opium narcotics, from the guy with the black shirt. This will remind you that any drugs that reduce bowel motility like narcotics should be decreased or discontinued. It turns out the guy in the black shirt wasn't about to give his friend some opium narcotics only, but also fast food. This time, the seller's partner took the food tray away from that guy to remind you that bowel rest by temporarily stopping the oral feed is indicated in the treatment of ileus. Sitting on the bench is a guy bored of all this drama. It seems like this scene is a recurring problem in this park he is used to. Anyways, if we look closely, we can see a straw in his nose, our symbol for nasogastric tube. The straw is here to remind you that an ileus patient's nasogastric suction helps to decompress the bowels, which helps to relieve the patient's pain. Right next to this guy is a bag of salt, and if you look behind him, we can see a saline bag connected to his forearm. The salt bag is here to remind you of electrolytes, while the saline bag reminds you of IV fluids. Putting things together should remind you that ileus patients require supportive care by replenishing electrolytes as well as hydration via IV fluids as required. And with that, you have everything you need to know about ileus diagnosis and treatment.